Startup Bugs PH is co-produced by One CFO, Credit Hero, Y Spaces, Simp, Secuna, Schooltech Bedfolio, Maroon Studios, and Red Circle Global. Check out our partners in the description.
Welcome sa isa na namang episode ng Startup Bugs PH, Kwentuhan at Philippine Startup Week 2025. Andito pa rin tayo sa Mount Canlaon Room ng Philippine Innovation Center dito sa Marikina City. At wow, we have once again from Cebu, SugboDoc. So, kwentuhan time tayo now. Hello Ryan, kamusta?
Hi Johnny, welcome, and congratulations again. You're doing a great job here. You have expanded your audience and I'm very honored to be back here.
Wow, salamat. Ako very, very honored din na we get to talk again. Kasi si SugboDoc din actually ay, after nag-launch kayo nung, I remember nung andun ako nung June, last year lang pala yun,
it was
sa
last
Cebu.
year.
Parang a few weeks after nag-launch kayo.
Yes.
Right? Tapos ngayon, may grabe na mga updates nyo eh. So, pa-update naman. Pa-refresh muna kami. Ano nga bang SugboDoc? Then pa-updates. Ano mga nangyari ever since nung interview natin nung June 2024.
2024, yes. Yeah. So basically, SugboDoc is a healthcare management platform streamlining operations for clinics, diagnostic facilities, and hospitals, as well as we provide digital solutions from the time a patient arrives, for example, from patient registration, medical records management, like prescriptions, mga lab requests, and now medical imaging and billing. So we streamline
all in one. I mean end-to-end.
End-to-end na. So hospital, kind of like a hospital information system na rin kami. From originally being just an EMR.
Still filling out loan applications for your business? Yeah, thought so. Save your time. Grow your business. With Credit Hero, one online application gets you loan offers from multiple lenders. Apply for a business loan now. Visit credithero.com.
Oo nga. Yeah. When I interviewed you, EMR talaga ang bida nyo eh, EMR eh. Kasi ang problem nyo pa nun na tinatakil is yung parang transferability ng mga records, right? Tsaka digitalization.
Digitalization, yes.
But I remember nung time na yun, nag-demo pa tayo ng teleconsult ninyo, naalala ko. Kasama si Oo.
Yes.
Tapos now, rin kayo, parang end-to-end talaga, may payment na nga rin.
Yes.
Yeah. So, bakit kayo nag-ganun? Why go to that direction pala?
So the original really intention was healthcare is really still fragmented. We know that we need to digitize processes in order to streamline it for the patient. We want to make the patient experience a lot better. And it also covers not just the medical aspects of it, but also even the getting access financially through claims and billing. So although our intention really is to address the entire gamut of healthcare facilities, which we're doing. So from small clinics, group clinics, we recently signed also with a group of animal bite centers across Cebu. So we connected all their healthcare facilities. So now patients can now just jump between branches and their records are still centralized and there's continuity of care. For
important yun sa animal bite. Actually, kaka-injection ko lang kasi na-scratch ako ng aso earlier this year pa. So, nagpa-rabies and tetanus shot ako. Pero, ang rin na actually, nawala ko lang ating record ko nun eh. Pero sana, digital lang nga rin yung record. So, kasama siya sa parang electronic medical records ko, yung animal bite. Wala lang, natuwa lang ako na pati nga naman yun. It's a clinic actually.
It's a clinic. And they actually have 16 locations across
isang company
the
lang
Philippines.
Isang company lang na...
It's one company. It's one company. They have 16 in Cebu, but actually they have more nationwide. I think more than 50 nationwide. So we're trying to close that as well. So for example, as you mentioned, right, the challenge with immunizations, especially to get the full protection, is you need to come back to the clinic. Kasi it's, for example, you need 3 or 4, 4 doses, right? So anti-tetanus, anti-rabies. So we made sure that we fully protect the patient by providing notifications, SMS for the patient para bumalik siya. And pwedeng magtalon-talon yung patient between branches kasi their records are centralized.
Para sa mga magta-travel. Kunyari, magta-travel ako dapat. Magpa-podcast ako dapat sa Cebu.
Yes.
Nakagat ako sa Luzon. Magdaman sana nakagat sa Manila.
Yes.
Kailangan ko pa injection ASAP. Pero yung next 4, And next 3, bad trip naman yun kung kumbaga kailangan bumalik sa Manila, magta-travel nga ako. So with this EMR, kumbaga EMR at saka connected yung mga clinics no. So pwede akong even sa ibang branch. So maaalala ko, ma-remind ako even while I'm traveling with the notifications.
Yeah,
wow,
right.
okay.
And not just like through rabies and tetanus shots, but we're centralizing the immunization as well. Kasi our chief medical officer actually is a pediatrician. So we're actually kind of biased a bit for pediatric care. So which includes centralizing immunization records. So all of the immunization needs for babies, for
like
example.
Mga hepatitis B ba yan?
Mga hepatitis, mga MMR, tetanus, DPT. So we actually centralize that so that if you visit actually a SugboDoc affiliated or powered facility, then they would know that pangilang dose mo na sa vaccine because we centralize it across the board.
Tsaka naalala ko lang yung sa rabies, parang ang inisip ko kasi nun, parang pag after mo na 4 doses, may time na parang immune ka pa eh.
Immune.
So I need to maalala ko yun eh. Kasi baka pag inisip ko immune pa ako, pero hindi na pala ako immune, hindi ako magpapa-vaccine, di na 99.9% fatality ang rabies eh. But anyway, wow. So I'm curious lang din, paano nyo nagawa ito? Like, I remember back then nga, parang target nyo was really to go to hospitals, big hospitals, clinics. So, ano yung naging parang marketing or parang sales strategy ninyo sa SugboDoc? Since nung June nga and up to now, yung parang naging progress nyo up to now?
Yeah, so going back, we had a podcast in June, and then just a few weeks, we actually launched our cloud solution. And we've always been iterating ever since. We've been improving. We've been supporting a wide range of like providers and specialists for doctors as well. And we connected with. We now have more than 100 clinics and hospitals on board.
Wow,
Yes,
grabe,
yes.
nakakatawa
Thank you,
naman
thank you.
yun. Ay, grabe, congrats. Tsaka in 1 year, no? Ay,
In
tama ba?
1 year
and a few months.
for 5 months.
Wow,
Yes.
grabe, congrats.
So,
100 plus.
And our strategy is actually growing through our sales partners, and which have strong healthcare networks. So we actually make sure, Philippines has 7,000 islands. So there's no way that we can efficiently and affordably reach all those fast. So we grow through sales partners who might have their own, who are closely affiliated with healthcare facilities, clinics, or
As in
hospitals.
third party, ganun. May mga ganun.
Yes. Third party, which might have
May
affinity network, and then they through sales partners, so they are helping us sell our solution.
But how,
Yes.
I'm just curious din, how, do you know like how exactly they sold? Parang ano yung value, how do they propose, kumbaga? Ano yung parang binibida sa mga, kasi it's not easy to pitch to, pwede rin nga na network mo na yung clinic, yung hospital, pero ano exactly yung sinasabi nila? Like, how do they sell si SugboDoc? What do you...
So we actually provide a really extensive training program for sales partners because they might be in healthcare, but they're not really very familiar with the product. So we actually provide them with this extensive training and to be able to be very specific and detailed when they actually talk to hospitals and clinics. But elsewhere, on top of that, we ourselves actually are very hands-on. So pwede kaming mag-offer talaga ng like really the implementation, the training directly to the hospital networks and the clinics.
Wow.
So
yung mga partners or mga onboarded clinics now, are they mostly in Cebu pa rin or all around the Philippines?
All around the Philippines na. We really have clinics, facilities in Luzon, Visayas, and Mindanao na rin.
Wow.
We've made sure na throughout the time we studied, it took us really a bit of time to study the market, especially in the Philippines. Although I've been in healthcare space, I've been designing systems for 7 years in Singapore, as you recall, and designing for clinics, hospitals, ambulatory facilities, and nursing homes. In the Philippines, it's a bit of a different case, so we had to localize the solution, and we understood what are the common needs for facilities, and we adopted international standards, which means that it is really common and it could be interoperable, whether it's in in the Philippines or even elsewhere sa labas ng Pilipinas. So common yan. Yung process is kind of standard, whatever facility that is. And we made it configurable if there are a bit of tweaks.
How about pricing? May parang localization naman ng pricing. I'm just curious. I mean, with regard to the Philippine market na
So our pricing is still standard, although we need to, change it a bit. It's still standard, and it's also on our website.
Okay.
It's for single clinics, it's $999. $999 per doctor, and then
per month,
and then it's also $10,000 for implementation per doctor. And then it goes up depending on the modules that they require, and also the number of staff that the hospital needs. And also we add on, because we've also developed a lot of different solutions based on the requests from our hospitals. So now more reports. We also are able to automate a lot of analytics and reports in compliance with DOH. So we made sure that we understand and provide solutions to make it easier for healthcare facilities to be compliant and to provide better care to patients.
Na-amaze pa rin ako. Grabe. Ang galing. Ang dami nangyari in that 1 year. Grabe.
Yes. Yeah, the team. I'm very proud of my team.
The team pala. So, ilan na ba yung team now?
So what I can say right now is our support team is about 13 people. And that's the people who actually help move and implement our solutions around. And we're constantly growing. We're also opening soon. We're interviewing. We're gonna hire a team for our Manila office soon.
Ayaw nga pala.
There's some opportunities here that we wanna close as well. But we're steadily growing. We're being conscious about being sustainable as well. Sustainable growth for the team. Yes.
Visit ako sa Quezon City office ninyo.
Sure.
Mag-part 2 tayo dun. About okay lang kasi usually so we did the part 1 before your lunch, and then usually I interview mga startups. Part 2 hindi yung ganitong kwentuhan, parang naman about how they became profitable, para how did they they twitched their business model, how they sold, ano yung business strategies, parang ganun. So hopefully makagawa rin tayo ng ganung episode, although syempre hindi ganun hindi natin ibubulgar mga trade secrets, pero parang lang, I want it to be matuto yung mga ibang founders, so parang something to learn.
Yes.
So baka yun, hopefully may type ka for next.
Sure. Always, you're always invited.
Thank you. Ay baka kung magla-lunch kayo, punta ako, mag-vlog ako doon.
Yeah, sure.
Office kayo.
Sige,
sabihan ko. Sige.
I'll invite you.
Sige, yung mga stories mo kasi, well, I know na because meron tayong episode before. So sa mga nakikinig, promise, Ryan is a very how to say it, wonderful, interesting person din. So if you want to know more about his background story, meron tayong isang episode na mas mahaba about SugboDoc, paano nagsimula SugboDoc, tsaka yung stories behind.
In today's digital world, your organization needs more than just technology. It needs a strategic partner. At Symph, we build web and mobile apps that drive innovation for startups, enterprises, and organizations worldwide. Visit symph.co today.
Protect your assets from bugs before bad hackers exploit them, and launch your products seamlessly with Sukuna, your trusted partner in cybersecurity. Receive reports in real time and work with security experts to find bugs in your products before others do. Let's make your security our priority.
Pero now, punta tayo sa Miss Universe question.
Yes. Okay, sure.
What is the most challenging part in building SugboDoc or in building the startup?
Okay, what's really challenging is that healthcare is so difficult to penetrate, especially in the Philippines. Doctors, especially, are super busy. They're very busy managing their own clinic, managing patients, shifting between clinics and hospitals.
Ayaw nga, may mga how do you call them, mga tama ba? Moonlighting, or yung mga summer consultants na mga...
they're also consulting with hospitals, actually. They have their own clinic, pero they're also doing rounds in hospitals. So their time is really very, very precious. So we have to work around that, and we have to grow with that in mind. And we have to be resourceful. Money is limited. We're always bootstrapping along the way. So which means...
Until now, bootstrapped kayo? No investor? Or
Yes. We're trying to do it growing sustainably, especially in healthcare.
Wow.
And we want to reach product market fit to a point where we really address the pain points and the stickiness of our solution as well. And at the right time, then we will want to probably mature enough, once we're mature enough and we've reached product market fit, then transition to the next stage of our startup, which is more growth.
Scaling,
of course.
Oh, wow. Let's have a podcast about that then.
That's another one.
Pero wow, grabe, natutuwa ako. I mean, tsaka congrats ulit.
Yes, sure. Thank you, Johnny.
What is startup success for you?
Startup success for me is really scaling and providing real impact to the people. For me, my motivation really is to be able to reach as much patients, impact their, provide better care through solutions through digital solutions, making quality healthcare accessible and affordable for them, and convenient as well. We want to reach as many of our patients, alleviate the needs of the healthcare system, help doctors. The doctors are super stressed. Healthcare providers are very stressed, knowing that we're so much in demand. They're exported, they go out of the country. So what's left in the country is actually really overworked. So we want to make an impact in the healthcare industry. And it's about time that we modernize it as well through digital solutions.
And baka lang pala isipin ng mga tao, rabies lang yung natin, rabies example natin kanina. Can you give examples lang ng parang actual, I mean, like a story, maybe if you have some stories there na parang anong mga actual stories, kumbaga.
Actual
stories. Meron ka ma-share.
Yeah. So for example, for our with the use of our platform. So basically when a patient comes in, because of our solution in our hospital, for example, being used in our hospital, now patients get the right level of care even before they arrive at the hospital. Doctors know the amount of patients that they have to see even before they arrive because they're already pre-registered. Now the entire process is faster. Before they had to search for index cards, the patients, right? They have to look through stacks of paper and then find the patient's
profile. Yung mga naka-A to Z, yung mga naka-alphabetical naman yun, pero hanapin pa rin.
That's still time. And then they bring the index card to the hospital, either to the doctor, and then the doctor looks through that historical records. But now it's faster because when the patient arrives, the doctors looks at the patient's profile, and it now has a longitudinal history. So if the patient authorizes the doctor or the care team to actually view their records across other clinics and hospitals, makikita nila yun. Makikita ng care team nila. So they can now see previous visits, their past medications, their past maybe surgeries or procedures, and all their allergies as well.
Mga detect na medications, important yun
and now because the records are available, it's an easy search for the doctor. So visible na siya, and they can easily enter all this information because we have, for example, in prescribing medication, we have an FDA approved list of medications. So ibig sabihin, they just type a few characters, lalabas na yung mga medications, and patients now have their actual prescriptions that are clearer instead of handwritten prescriptions, right?
Mahirap
basahin. And we made sure na there's more data, there's more information available. So clearer na. And then hanggang sa billing. So we help hospitals achieve higher revenue because patients now are sure that they'll pay because they go through the prescription. They'll retrieve the prescription first before they actually pay. Dati kasi binibigay na ng doctor, sometimes
lalabas
na. So nami-miss yung mga payments na yan inadvertently.
Yun din pala yung marketing dito, no? The hospital can actually earn more than actually.
Yes, actually the hospital earn more, and especially that our facility also recommends on top yung mga top. For example, there's an inventory of their medications. No, lalabas yun on top yung mga. So it helps avoid yung mga expiration ng mga medications kasi there's more movement dun sa what's available in their pharmacy. No?
And naisip ko lang yung sa yung mga note kasi yung pangit na sulat ng mga doktor. Kaya pala ganun kasi ang dami nilang sulat. So
ang dami, yes.
It's a given busy mga doctors natin, overworked. But with this, well, hindi na kailangan sulat na marami. Tsaka encoded na. Encoded na,
digitized. And all the past medications are
Naka-record na.
available.
Oo nga, no, yun pala pag ganun sulat, mahirap na siyang tandaan later on.
Yeah, and patients can see na their records din. They have an access to their portal, so kita nila.
Ano ba, web app or may mobile app na rin ba?
For now it's a web app. So kita nila yung past medications, yung mga lab requests, and now nadagdag is yung imaging na rin.
Ay, oo nga, no. So yun pala ang problema dati. Yung medical records ko, nasa doctor ko lang.
Yes.
Ngayon, pwede ko tignan anytime.
Yes, now it's anytime. So if they're using SugboDoc din, because a patient centralized na yung records niya across, for example, 10 clinics or 10 clinics and hospitals combined, kita na ni patient yung lahat ng records niya always. And if they're not using SugboDoc, they can always like upload and take a picture and upload it on the platform.
So ano pala, do I have to make an account, or when I go to a SugboDoc clinic, SugboDoc partner clinic, sila nang gagawa ng account for me, or I can make my own nga?
You can do both. You can do both. You can create your own account, or with the facility, with the staff, they can create your account for you.
So then mas may account ako, i-add na lang dun yung mga records nga. Yes, what if gumawa account and then nakalimutan ko, gumawa ng account yung clinic, pwede ko ba i-merge yun? Something like that.
The merging will happen later. But it can be done.
Okay.
But if you already have an account, you can actually tell the clinic na may SugboDoc account ID ka. And then they will just add their profile to the hospital. Kasi the key here is a single like healthcare ID across all hospitals and clinics.
Yun nga. Actually, that's the next question. That's the last question actually. What's the vision? So yun ba yung vision?
So our vision really is better connected healthcare, because we want to make quality healthcare accessible, affordable, and convenient for everyone. And part of that is making sure that your profile is available with a doctor who actually needs to provide care for you. So better diagnosis, better treatment. Now with a full view of your history as a patient, right?
And ito pala, what keeps you motivated?
Motivated. A lot. Knowing that our solutions are providing impact for our doctors, for our nurses, our patients, who are now getting better care, who are now able to own their own healthcare and are now proactive in maintaining their own their own lifestyle and health. They now have visibility for what they need to do. They're always reminded of what they need to get full protection, for example, for vaccinations. So overall, we're impacting the healthcare ecosystem, and really it hypes us up in the team. We're all motivated. I have a very inspiring, motivated team who's really working with me, and also being with them is also helping in our motivation and making sure that we work towards a better Philippines in terms of healthcare.
Better Filipino healthcare. Yung na-mention nga na term kanina in the previous episode lang, shared vision. Wow, shared vision.
Yes.
Education is evolving, and so are we. Introducing School Tech by Edfolio, your all-in-one school management solution. Built for schools of all sizes, School Tech bridges the gap between school and learning management. Driven by passion, School Tech makes educational technology accessible, affordable, and easy to use for schools everywhere. With an integrated approach, School Tech simplifies management across different departments and enhances efficiency in operations. School Tech transforms the way schools manage, teach, and learn. School Tech, taking school management solutions to the next level.
Running a business? Make it smarter with Red Circle Global. Streamline operations, boost productivity, and manage everything in one powerful ERP system. Book your free business demo today at redcircleglobal.com, guided by one of our top experts.
Ayun, sige, grabe. Thank you so much, Ryan, for this
Thank you so
kwentuhan.
much.
Baka pala may tayo listeners baka may clinic, hospital, or may user
Yes.
who want to work who want to use SugboDoc. Naisip ko lang, investors, are you welcoming or hindi ba muna?
We always welcome talk to investors.
Okay.
In anticipation of our upcoming siguro round, maybe next year.
Wow, mag-raise kayo ng ano.
At the right time.
Tsaka for scaling talaga.
For scaling, because we want to go global.
Wow, grabe.
But we want to make an impact first in the Philippines.
Yes, okay.
Yes.
Wow, tapos yung pangalan SugboDoc, no? Tapos global, grabe. Ang proud naman. Cebu Pride din.
Yeah, I mean, somebody has to help as well in the Philippines. So we're doing this so that parang marketing for Cebu. We want to make Cebu known for innovative entrepreneurs. And we want to make sure that also the entrepreneurial ecosystem in Cebu is also given a highlight.
Yun eh. Para for me nga, well, aside from a unicorn startup, yung parang magkaroon ng pride, startup pride. May isang maging successful sa isang lugar, Cebu. Sobrang sobrang uplifting na
Exactly.
for the entrepreneurs in Cebu, for example.
Exactly. And Cebu and the Filipino people.
Yeah, and the Filipino. Yeah, so how can they connect with you pala? Maybe website or Facebook page?
Sure. So you can connect with SugboDoc through facebook.com/SugboDoc or SugboDoc.com if you're a hospital, if you're a clinic, or you have network of facilities that you would like to modernize and digitize. It's very easy. We provide a 1-month free trial. So it's a no-risk trial for your hospital. You want to try it out. We train you online, or if it's within the vicinity, then face-to-face. We go to your facility and we make sure that we train your users so that you realize the benefits of a modern, streamlined healthcare system, from patient registration all the way to medical records management to billing.
Streamlined healthcare system from patient registration to records
management
to
to billing
and payment.
Payment.
Yun ang ititle ko dito para searchable sa SEO tayo.
SEO, wow.
Thank you so much. Ayun si from Telerad.
So,
thank you so much.
Thank you so much.
Thank you very much to our 65 patrons. This episode is super powered by Asklex PH Academy, our official e-learning partner. Get certification on Lean Six Sigma, project management, data science, and more. Architect Space Solutions. Architect provide ground station services, space data analytics, and technology supplies to grow the Philippines' role in the global space ecosystem. Divico Technologies Incorporated. IT solutions specializing in software development, blockchain smart contracts, digital wallets, and cybersecurity. NutriCoach. Personalized nutrition and weight loss programs for you. Argum AI. Make smarter decisions by presenting both sides of an issue as argued by two distinct AI models. Pixel by Implement. Turn content into opportunity, grow deeper connections, and earn more. Only with Pixel. Sign up at pixel.implement.co. School of Profits. Filipino-led community for aspiring freelancers, VAs, agency builders, and all-in earners, built to help you start, grow, and earn all-in together. Founders Launchpad, our ecosystem partner, early-stage accelerator providing venture capital funding, operational support, and mentorship. Hire Business Solutions, provider of the most configurable cloud-based payroll system in the Philippines. Agile Data Solutions, the Philippines' fastest-growing market insights tech company with its data gathering platform, HustlePH. Smile Checks, streamlined hiring and onboarding with automated background checks. Cloud CFO, cloud accounting service provider for businesses ready to grow. Cloverly, all-in-one digital platform for property developers. Body Beauties, accessible and personalized diabetes self-management application. HKB Digital Services, tech-based business tools including payroll, ticketing, and loyalty rewards. Hyperstocks, digital banking enabler for rural and thrift banks. Wonderbrand, data science-driven brand strategy and design for emerging markets. This episode is powered by Josie AI, Uplift Code Camp, Board Prep, Kansan Barley, East Point Business Outsourcing Services, Filipina Home-Based Moms, Hex Colony, Jur.ph, Big Giant Games, Pahatid PH, SugboDoc, Agacon Aquafeeds, Juan Alj, Grey Wolf Technologies Philippines, Pareto Consulting, Sirius MD. Support the podcast through the link in the description.